There's something about watching the process of how a student goes from being a medical student and graduating medical school, and then over the course of time, growing and developing the skill set to be a ready to go into practice physician. And when we see so many of our graduates out there in the community now, practicing really good medicine, taking really good care of the people in our community, that's really gratifying. And I think that's always what's been the most satisfying thing for me, is just seeing how great our residents do when they're done.
Not only am I taking skills and knowledge away from this, but just watching the leadership here, I'm learning how they function as leaders, and those are some skills that I will definitely be taking with me. There's a lot of programs where the leadership is out of touch with the people who are on the front line, and it leads to a very brittle type of culture. Here, that's not the case.
Everyone's just genuinely trying to make you a better person and a better physician here.
Some of the benefits, I think, to our program are we're a little bit smaller and we're completely unopposed. The family medicine residents are the only residents within the hospital, along with the transitional year residents and then the hospice and palliative medicine fellows. You are working one-on-one with the attending, you're getting that individualized attention, you're first assist on the surgery, you're delivering the baby with a OBGYN. Like, you are the resident, you're not competing for those spots.
We all go into medicine to help people. But not only do they get an opportunity to help people while they're here at Firelands, but they also get top-notch training in the process, so that when they leave here, they're ready to provide that care to their own patients. And then whether they decide to set up here or whether they go across the country, we've got graduates all over the place.
We have a lot more independence, which is really nice. It's not so much that you're on your own, but more that there is, somewhat higher expectations of you to do a little bit more for your patients. The fact that I don't have to refer out to a specialist for everything. I can figure it out. They encourage you to do that. And I think that's really cool.
If you want to do sports medicine, there's opportunities for that. If you want to do women's health, there's opportunities for that. And our program works to allow you to have those opportunities, so when you go into practice as an attending physician, you feel prepared to do exactly what you want to do.
And of course, this is a community-based residency program, and so we'll be working with community clinicians, and the clinicians that provide educational opportunities have been working with the medical education department for many years.
And I feel very confident that the people that we've graduated move to their next program with probably the best clinical experience I think you could find anywhere.
We've seen about 1 in 4 of our graduates stay in practice, which is a very high number, especially for a community-based program.
I think here it's not just about preparing you with knowledge, it's really about preparing you for as a lifelong physician, but also a lifelong learner.
In talking with some of my peers who did rotations at other places, they just didn't have the autonomy, they didn't have as much hands-on procedural experience as I did here. I just had a really good experience. I was learning a lot as a student, so I decided to stay for 3 more years.
I'm very happy I made the choice to be here. It feels like home. I'm comfortable around everybody.
I have loved living in this community, being on the shore of the Great Lakes. It's hard to describe what it's like to live along the edge of one of the Great Lakes if you haven't done it before. It's a one-of-a-kind experience.
It's that nice balance of being able to work but then also enjoy your life. That work-life balance, I think, is really important for a lot of residents, and you definitely get that here.
We've seen residents put together sports teams or trips to Cleveland to go to theater events. We have faculty members who are doing sailing races, and I know we've got residents who are joining them on sailing races. We've got residents involved with community outreach organizations, and the more people get involved in the community, the richer the experience is for them.
Everyone is just so friendly and welcoming. It's a special place.